Well, welcome to today's session. We are so happy to have you here and appreciate you taking the time out of your schedule. I know that we had asked that you update your name. If anybody's having difficulty doing that, if you hover over your picture, you're going to see three little dots in the upper right-hand corner. If you click on that at the bottom, you'll see rename and you can type your name in. This just gives us an account of everybody who's participating today. Next slide, please. By way of introduction, my name is Stacy Villano, and I work for the Global Rural Nursing Exchange Network, or GRNEN. And our mission is to connect nurses, students, educators, researchers, anyone who is actively working in rural healthcare or who has a passion for improving the health of rural communities, with a specific attention to the role that nurses play in serving these communities. We are a worldwide organization, and it's just really incredible to see the global community come together to provide support and exchange ideas through our platform. One of the ways that we bring these resources, education sessions, and connections together is through partnerships like we have with the USD, something that I think we're in our third year. This is just a really powerful partnership for GRNEN because we have the privilege of taking these incredible real life experiences that students are participating in via the HRSA grant and bringing them to a global platform. So students from around the world get to see the experiences that you're having, and educators get to see how these programs are coming together to potentially give them an idea on how they can continue or adopt programs like this in their areas. So that way we can encourage more people into rural, show more people what rural career and opportunities there are, and encourage educators to do the same, and hopefully to bring more students awareness to what USD is doing, so that way we can help and support build the program. Next slide, please. Before we get started today, just a few housekeeping items. We'd like you to keep your microphone muted at all times to prevent feedback while the speakers are presenting. We will have plenty of time for Q&A in between each one of our presenters today. So at that point, you can always just drop something in the chat, the Q&A, unmic, and ask your questions. But in between them, please do keep it off. Conversely, please keep your video on. We want to be able to see everybody who's participating today and keep an active and engaged audience. Given the nature of our conversations, we do ask that when you're speaking, you maintain confidentiality at all times. If you have a question, if there's something happening, technology, what have you, drop it in the chat. We will be monitoring and we're here to help you. We want you to get the most out of your session today. And it's important that we share that the ECHO movement collects participation data for TeleEcho Health Program. So enjoy the session. We hope that you'll collaborate with us. You'll ask your questions and actively get engaged and learn. And then invite others to attend, as this is not the last in this beautiful series that we're conducting. Next slide, please. I am sure everyone knows Dawn, so it is my pleasure to turn this over to her so she can go ahead and kick off today's session on recruitment and retention strategies as part of the Heart of Rural Nursing series. Thank you, Dawn.
Thank you, Stacy. And I'm excited that there's so many people that are logged on today. This is fantastic. As you know, we've been doing these series for a long time, and I'm very excited that the one today really focuses on recruitment and retention strategies. So as you know, we'll talk really the first, probably 2/3 of it. The students will share the experiences they've had in these small rural hospitals, which have been great. And then the last part of it, we have an expert speaker with us today, Ricky Plagemeyer from Sturgis Hospital, Sturgis Monument Health. And as soon as I saw the topic for today, I immediately thought of Sturgis. Ricky has just done a phenomenal job with the culture there, and her nurses don't leave very often. They kind of stay there forever and ever, just because she's done such a good job. So I'm really happy that she was able to join us. And she's a Yote too. She graduated from USD and has been a phenomenal leader. So super excited about that. Okay, you can go ahead and go to the next slide. So just a real quick recap for anybody who might be on that doesn't know, this HRSA grant, it was a $1 million grant over 3 years, been very successful. There have been multiple parts to the grant. The big part that we will be talking about today was the part where we sent nursing students to rural hospitals across the state for a 132-hour clinical immersion. And then the grants helped pay for them to be there, give them a stipend, et cetera. And it has just been a phenomenal learning experience because otherwise students did all their clinicals in big hospitals and just really didn't get the experience of small rural. And it has really increased their interest in going into rural health. So been very rewarding. We're actually on our last semester of it now, which is unfortunate. 3 years went by quick. Okay, next slide. So since this is global and these webinars are available globally, just so people know real quick, we are in the United States of America. Next slide, Clara. And we are located in South Dakota. And next slide. And South Dakota, this is a map of South Dakota. It is a very rural frontier state. And these X's are different areas that we have had nursing students do this HRSA grant. We've had over 100 students do the grant. Many places we've gone to multiple times. So, for example, Sturgis, Spearfish, and many of the ones over here we've gone to multiple times. And there's even a few more this semester. I was just on the road last week visiting students, and we have new places that we're going to that aren't even on this map. So, but the challenges of a very rural state is that there's a lot of areas, especially up in the top here, and on the west side, just this whole upper area where there's just not even very many hospitals and a lot of farmland. So it's really challenging for some of our citizens in our state. Okay, next slide. Okay, so our goals for a little bit later for what Stacy is going to talk about are really related to recruitment and retention strategies, kind of what gets the nurses there and what keeps them there, and then talking about measures that utilize, any things that she might want to talk about to address burnout or, just that positive culture that she has done a good job of creating to help retain the nurses that they have. Okay, next slide. All right, so I'm going to go ahead and we're going to get started. We have 4 students today, and I'm excited to hear their presentations. So we'll go ahead and I'll introduce the first one. So our first student is Mia, and Mia did this clinical immersion, HRSA experience at Prairie Lakes Healthcare System in Watertown, South Dakota. So Mia, I will turn it over to you.
Okay, hi, my name is Maya, and like
Maya, I am so
Dr.
sorry,
Warren
Maya.
said, that's okay. That's okay. Like Dr. Warren said, I did my experience in Watertown. It has a population of about 24,000, so definitely on the bigger side, but the healthcare system in general definitely has more of a rural feel. It is an 81-bed acute care facility that includes medical, surgical, peds, labor and delivery, critical care, and telemetry units. It also has an emergency room and then outpatient dialysis and cancer centers. Some of the workforce challenges that I encountered were lack of experience. My nurse had been a nurse for 5 years at the time, but just over 1 year in that specific hospital. And there were some nights where she was the most experienced nurse on staff. And then my second workforce challenge was that the physicians there didn't have any specialization with pediatrics. So 2 of the 3 peds patients that I cared for, we had to transfer to Sioux Falls just for a higher level of care. And that's about a 1.5 hour drive. My memorable story, one night we were caring for an elderly patient waiting for nursing home placement. She had severe altered mental status, and she woke up in the middle of the night asking for her supper. So we tried to re-explain that. Well, it was 2 a.m. You already had your supper, but we can get you a snack if you want. So my nurse was listing things off. She's like, yeah, pudding, jello, ice cream. And she just stopped in her tracks and just chocolate ice cream. And that was the most she had ever conversated with us. So it was a slower night, and we were able to sit in her room for about 20 minutes, just feeding her chocolate ice cream. And that was the first time that she was actually able to hold a conversation with us and kind of spit out coherent phrases, sentences. But and then we let her go back to sleep. She woke up the next morning and she was kind of back to herself, where her words were just all mumble jumble. They didn't really make sense. So I still can't make sense of that situation, but it was a pretty sweet experience. And then my key lesson learned was just I learned the importance of being prepared to face any medical condition and provide well-versed care, because it's not a specialty floor and you just see everything and anything. You never know what kind of needs your patient's going to have. So just being prepared to see a plethora of things is very important in rural health.
Maya, I have a question for you. So you
Mhm.
said on nights, your nurse sometimes was the most experienced with only 1 year. So do you have any insight, like when you interviewed the nurse manager, any insight on why their turnover is so high, or do they have a lot of travelers, or like how are they handling that? And do you have any idea why it's like that?
I think they just had just the nurses on staff were more like new. They weren't new grads, but everyone was just younger. They had recently graduated. I don't know what led to a lot of them being employed at the same time. I don't know what came before that. But from my experience there, everyone seemed happy. They liked working with each other. So I don't know what would drive a whole bunch out that would require you to hire a lot of different nurses at the same time. So I don't
Sure.
have a ton of knowledge on that. But
Yeah. Did they have to utilize travelers, or did they not have travelers? Do you know?
I didn't experience any travelers while I was
You
there.
know, tourism travelers. Okay. Okay. Yeah. So that certainly can make it challenging when you don't have as many nurses that are, have as much experience. Definitely have to rely on teamwork a little bit better. But okay. And then you said an hour and a half. So if a patient had to go to a bigger hospital, typically did they go
Mhm.
to Sioux Falls or Aberdeen, or where did they
Yeah,
go?
they would go to Sioux Falls, hour and a half ambulance ride. I
Okay.
don't think we had to fly any patients out while I was there, but I know that they can do that in extreme circumstances.
Okay. Excellent. All right. Anybody, any other questions for Maya? Okay, if you think of questions, and we've moved on to the next person, that's fine. Just hang on to them, and then at the end, we'll come back to them. So, okay, let's go ahead and go to the next one. Thank you, Maya. All right, our next speaker is Tasha Ramos Hernandez, Pioneer Memorial Hospital and Health Services. This is in Viborg, South Dakota, and this is where she completed the clinical immersion. So, Tasha, I will turn it over to you.
Hi, my name is Tasha. So, like Professor Warren said, I completed mine at Viborg, South Dakota. So, Pioneer Memorial Hospital is a 12-bed critical access facility that also includes an attached clinic, nursing home, and assisted living center. Even though it's small, they have a lot of services like laboratory work, on-site therapy that includes OT, PT, and speech, a CT scan, DEXA scan, and MRI. They take care of a variety of patients, including inpatient, outpatient, swing bed, cardiac rehab, and wound care patients. Um, the care team is mainly made up of CNPs, and they have two PAs and then one DO and one MD. And then two nurses are scheduled during each shift to care for the ER and med surg part of the hospital. So workforce challenges, I'd probably say one of the biggest challenges is limited staffing. With only two nurses covering both the ER and med surg part, it can be tough to keep up when things would get busy. And by busy, I don't mean like major traumas coming in. I mean, at least when I was there, we didn't have any traumas that required like transfers, but more like when one patient was in the ER and then we had another patient with their call light, it was just kind of hard to manage at the same time, and not having any aides makes it even harder. A memorable story. So one memorable experience I had was when a Hispanic patient came in to the ER after a heavy piece of metal fell onto his big toe, causing a minor fracture. What really stood out to me wasn't the injury itself, but the communication part. Because when my nurse was getting their like basic information, like name and date of birth, the translator line stopped working. And so since I spoke Spanish, I stepped up and translated to the best of my ability. And I could tell that the patient instantly felt more at ease knowing that someone spoke the language, and it made them even more comfortable asking questions too about their care plan. Um, the key lesson learned. So what really hit me during my HERS experience was just seeing how much the nurses do. With only two of them covering both the ER and med surg, they were like nonstop running between call lights, checking on their patients, and handling whatever came through the door. It honestly amazed me how much, how they managed to stay on top of it all, especially with limited staff. And watching them made me realize how much skill, patience, and dedication it takes to be a nurse, and it gave me a whole new level of respect for the profession.
Excellent, Tasha. I hear that over and over with the students in these small rural hospitals. They just are like in awe of how the nurses are really jack of all trades, and they do such a great job at everything because they have to. They're kind of it. So I have a
Mm-hmm.
couple questions, but I wanted to open it up to if anybody else has any questions first for Tasha. Things you're wondering about. One thing you mentioned, Tasha, do they not have nurses aides at all, or just occasionally, or you said it was just two nurses, but no nurses aides to help?
Yeah, no, it's just two nurses. I think
Wow.
when I was there, I acted a lot like the patient care tech because they just didn't have any help.
Sure. Right. Okay. Yeah, they probably appreciated you a ton. It seems like in some of the small rural hospitals, the nurses' aides really help a lot. I was just at a Sadaho conference and they really talked about that, how in a lot of these small hospitals, the nurses' aides and the medical assistants and stuff are really stepping up to help. So I can imagine how busy those nurses were. And then the
Yeah.
language barrier thing, I'm just curious, what do you think would have happened if you weren't there, or what other options did they have? Because certainly in some of these communities, there's a lot of language barriers.
So they resorted to like a phone call instead of like a iPad where you can see like face to face between the communicator and the translator. Tell me what they would have done if I wasn't there, I guess, just through a phone call.
Okay, so they did have a backup plan, but okay, yeah,
Mhm.
because I'm sure the language barrier is even harder when there are only two nurses, right? The chance of one of them speaking the same language is pretty small.
Yeah.
Okay. The only thing I'd be curious is, do they have nurses on call? So, like, say a big accident did come in and there's just the two nurses. Are there other nurses on call, or do you know?
Um, I guess I don't really know.
Okay, that's
I
okay.
do know that the nurse manager there does step up sometimes to help, but
Yeah.
on call, I don't think so. I've seen like the lab techs and providers on call. That's it, but not nurses. I don't know
Okay.
about that.
All right. Excellent. Great job. Anybody questions for Tasha? Okay, we're going to go ahead and move on. Thank you, Tasha. We'll go ahead and go to the next slide then, Clara. There we go. All right, Divya. I'm Divya. I don't want to totally destroy your last name. So, but Divya had the pleasure of doing her HRSA clinical immersion at Sanford Chamberlain Medical Center in Chamberlain, South Dakota, which is like right in the middle of the state. So, Divya, I am going to turn it over to you.
Okay. Hi, so as Dr. Warren said, that I did mine at the Sanford Chamberlain. It's a hospital and a clinic that's located in the Chamberlain, South Dakota, and it's a part of the Sanford healthcare system, which serves like Brule, Buffalo, and Lyman counties. It provides like it's a wide range of services in the rural hospital, and it's a 25-bed hospital. So they have an emergency care, family medicine, surgery, OB/GYN, women's health. They do orthopedics. They have a dialysis room. They have a rehab, and a walk-in care clinic, and they also have a nursing home. Uh, and then there are a couple like equipment medical stores in the town, such as like pharmacy or like for any equipments that needed for help. Some of my workforce challenges that I noticed that it's like hard to recruit doctors and nurses in small towns. I realized that there were so many travel nurses, like during my clinical, like there were 4 or 5 travel nurses, while only 2 or 3 of the nurses were from like near Chamberlain or someone who was from South Dakota. Uh, sometimes, like I said, sometimes they would have to send nurses home because they were overstaffed and they only had like 2 or 3 patients, while there were a couple in the ER. Um, then I also noticed that like one of the major issues, like I said, like staff, like if they leave, they had to I learned that they had to close one of the Sanford clinics because they lost a doctor and an NP there. Um, because like they can provide every specialty sites as well, they have to send out many patients that require more advanced care to hospitals like Sioux Falls and Mitchell, which I think Mitchell is like about an hour and Sioux Falls like about 1.5, 2 hour, I think. Um, for one of my memorable stories during my clinical at Sanford, there was this pregnant woman who came to the hospital thinking that she was having a contraction. The staff monitored her for a couple hours, but she wasn't in any active labor. So they sent her home later that night. She delivered the baby at home and then came back to the hospital. Like this kind of showed me how unpredictable rural care can be, or any hospital can be. Like even though you had enough staff, resources ready for emergencies, anything could happen in healthcare systems. Like one of the key lessons I learned was that, like in rural hospitals like Saintford, lifelines of the like those little tiny hospitals are like lifeline of their communities if they want to like any kind of help, like health wise or anything. Like that's the only thing they have. But like when they lose like a doctor or NP, then it just like one thing that just closed down, and there are like 3,000 people that have to travel to like 100 or 150 miles to just get their healthcare benefits. And then I also learned that a good, like when you put an IV and if there's a blood, it's a good IV. So that's what my nurse told me.
I love it. Good variety of lessons.
Mm-hmm.
So do you know what kind of things they were doing, just by curiosity? I don't know if the nurse manager mentioned this when you talked to them, but what they're doing to try and recruit more providers, more
They
physicians,
are like
or
they are trying to like reach out to more Sanford hospitals and see if like people would like and doctors would come and visit at least like 3 times a week or 4 times a week rather than only once. They did have like 2 or 3 doctors that were there on call, but sometimes that would also make it like difficult. So I think that's what one of my nurses said, that they were like trying to contact Sanford and see if they can like send out more doctors to the hospital.
okay. I know over the us doing this these last few years, there have been many hospitals I've gone to where they have temporary, almost like a traveling nurse, but a traveling physician who's there for just like 3 months,
Mm-hmm.
just to get them through. And it seems like even more so than the others is OB docs. We're really struggling in the state to get OB docs in a lot of these rural hospitals. So, but it sounds like you guys did do OBs at your hospital, right?
Mm-hmm. Yeah.
Yeah. Okay. So that's good. Hopefully they'll be able to keep that going for a while.
Yeah. Thank you.
Okay. And then I just be curious, what time of year were you there, Divya? Were you there in the summer?
Yeah, I was in the summer. I think it
Okay.
was June, early
Okay.
June.
I would think with that being right on the river, you
Mm-hmm.
probably, people who come in, there's are probably more related, like camping, boating,
Mm-hmm. Like
touristy
fishing and
stuff.
all that.
Yeah.
Yep.
Okay. All right. Questions for Divya? Okay. I think we're going to go ahead and move on to Catherine. Catherine Hallstrom is a nursing student, also like the rest of these. She completed her HRSA clinical immersion at Lee Deadwood Hospital up in Deadwood, South Dakota, which is really close to Leeds. They call it Lee Deadwood Hospital, up in the Black Hills. And I am going to turn it over to Catherine so she can tell about what she learned.
Hi, my name is Catherine. I'll start with a little background on the area and the hospital. Between Lead and Deadwood, the population is around 3,300, 3,400, somewhere in there. It's out in the hills, so there's a lot of tourism in the summer. Lots of people out there riding their motorcycles. Um, and then like search and rescue, and a lot of hikers out there as well. The hospital itself is a 4-bed ER and about, I believe, 16 inpatient beds upstairs. They do labs there. They have imaging there, so they can do CT, MRI, X-ray, all that stuff. And then they do have some therapy as well. Um, some challenges I noticed while I was out there, unlike the larger healthcare facilities, there's no trauma teams, there's no stroke teams, there's um, no teams like they would have in a big hospital to call to the ER if they needed help for something. So the nurse has to be really well-rounded, and know how to respond to everything fairly quickly. Um, the and it is just one nurse down in the ER. So they have paramedics up on the third floor that'll come down and help if the nurse needs help. The most memorable patient that we had was found unresponsive by her husband. They called 911, EMS went out, brought her back. And just about as soon as they brought her in, the nurse and the provider that was on at the time could tell she had a UTI just by the smell, which isn't something I experienced before. But they took her in for some imaging and then brought her to the ER. We straight cathed her and started her on some antibiotics right away. And it was just interesting to watch her go from, she was like barely oriented to herself when she came in, and then once we got those antibiotics on board and they started kicking in, it was interesting to see her to go from that to knowing where she was, who she was, and what was happening. Key lessons I learned while I was out there, definitely needing the well-rounded knowledge, and like I said, being able to respond to everything fairly quickly. Anticipating the provider's orders. So knowing, this is what's happening, he's probably going to have me start an IV, so let me get all this stuff ready, and different things like that. And then a lot of the patients out there, if they were too acute or they needed specialized care, they would just stabilize them there, and then they would transport them to Rapid City. And like I said, just that one-on-one communication with the providers and anticipating their orders and what the patient's going to need.
Excellent job, Catherine. A couple things I jotted down. One thing that's interesting for those of you who don't know the Deadwood area, it is a huge gambling town. So I don't know if you experienced that much, Catherine, but some of the students who have been there have had patients related to that, who, whatever, drinking a little bit too much, some drug activity stuff with the gambling, or in the winter skiing accidents, because it's also a skiing area. But it's kind of interesting how where you're at determines some of the patients you're going to see more in the emergency room. And you're right, those nurses they kind of do everything just because they don't have a stroke team, they don't have a cardiac team, for acute MI. They just do a little bit of everything. Now they do not do OBs there. Is that correct, Catherine?
No.
Yeah. So anybody, unless it's emergency, right? Every
Right.
hospital I've gone to and asked about, and they say only if it's an emergency. On these small rural hospitals, not very many do their own. I know for all the nursing students, I know a lot of you that are on our nursing students, but I think Catherine brought up a good lesson that I'm sure you've talked about in class many times. And this is perfect. When an elderly patient comes in that's confused, acutely confused, I don't know the percent, but it's very high, to just automatically assume that it's a UTI and rule it out, because so many times it is. So I was a classic example of a UTI and how the antibiotics did the trick really, really quickly. Sometimes patients will even just become kind of mean, or start hitting and doing things that are really out of their character. And many times it's because of a UTI that hasn't been caught. So Okay, what questions do you guys have for Catherine? Everyone's being really quiet. Okay, I'm just looking down the line here before I turn it over to Ricky. Maddie and Audrey and Lainey and Emma, Callie. What questions are you guys curious about for any of these 4 students? Okay, then I'm going to go back real quick before I turn it over to Ricky and just ask the 4 of you, what was the most rewarding part of doing this experience in a small rural hospital? What do you think was the most rewarding part?
For me, it was seeing some of the same patients. I know that's not a good thing. You don't want them to leave and come back. But a lot of these nurses have cared for these patients for several years now. They've been around. They kind of know who they are as people. And I got to know that as well and experience that. So that was good.
Yeah, excellent. I've heard that a lot because in the small towns, everyone kind of knows everyone. They're almost like your family, especially when you see the same patients over and over. Okay, Catherine, Divya, Tasha, what would you say was your most valuable part of being in the small rural hospital?
I
I
thought
think
that
it was kind of getting to practice all of the skills that we've learned between class and lab rather than like at clinical, you're just more focused on whatever unit you're on. So I think it was being able to see a little bit of everything.
The variety. Yeah, agree totally. Okay, thank you. And Divya, I think you were starting to say something too.
Yeah, I was just gonna say, like, even though like it was a like I didn't expect it as much. Like I was like, okay, this is gonna be a small hospital. Like like I didn't expect it to see many different cases, like how Catherine said. But I got to see so much, where I was like, okay, it's kind of like different to see. Like I got to see, like I said, delivery. There were like a guy, like there was a guy, he fell from like his RV and then he came to ER, and then there were like a lot of different varieties that I got to see as well, like which I didn't expect it, but I learned a lot from it.
Excellent. Thank you, Divya. Tasha, can you think of anything?
For me, it was probably just getting the experience, practicing skills, especially since I didn't come to nursing school with any experience, like healthcare experience. I liked connecting with patients, getting some IV started, and doing other skills that we haven't learned yet. It was just really rewarding, the whole experience.
Awesome. Well, I hope you all keep rural healthcare in mind as an option for when you graduate. I know a lot of people have committed to a certain hospital while they're in clinic, while they're in nursing school. Hospitals kind of say, hey, and recruit them early. But we are finding that a lot of students will work for a year or so in a big hospital, and then they want to go back to a small rural hospital. So I hope you keep it in mind. That was probably the most rewarding place that I worked, was a small rural hospital when I did it. Okay, I am going to now turn it over. We can go to the next slide to our subject matter expert. Again, we're focusing today on recruitment and retention strategies. So I'm going to, next slide, introduce you to Ricky Plagemeyer, who is the nurse management in Monument Health Sturgis Hospital in Sturgis, South Dakota. So Ricky, I will turn it over to you.
Hello. So I really was hesitant to do this because I'm not a good speaker, but Dawn's pretty convincing. A little bit of background on me. I did, like Dawn said, I did attend USD, graduated in 2002, which is a few years ago. But before that, my background is I worked in the hospital as a CNA and a ward clerk in this very hospital here in Sturgis. I taught for USD some clinical work. I think I did that about 8 years and worked the floor. And so I've had a variety of experiences because I also taught out at the VA for USD as well, which was psych clinicals. Not my favorite subject, but it was psych clinicals. About our community and our hospital, we are what you guys have been talking about. We're a critical access facility, which means Medicare basically reimburses us and licenses us for 25 beds. We're similar to Deadwood. Deadwood and Custer are also in our system through Monument Health. They're critical access facilities too. That's really kind of it about us. We do have ER, of course. We have a clinic and urgent care attached that are open. The urgent care is 7 days a week, 7 to 7, which is a newer addition to our facility. We have a long-term care attached to our facility as well that has about 40 residents in it. We have a surgical department, but we don't do surgeries. So there's a common theme. We do have some resources, but we don't have all the resources, and that's what critical access is. So yes, we have an emergency room, and yes, we do have one ER nurse, but we also staff with a CNA 24/7 as well, because we don't have registration after hours. We don't have respiratory after hours. We don't have pharmacy after hours. So again, limited resources. So you're right. The nurses are very well versed in doing everything, mixing meds, registering patients, providing the care. We just recently started adding another nurse to the ER during the day and during night. So the staff are excited about that. I don't really think I can tell you much more about our facility besides that. We do a lot of swing bed transitional care patients, and so they do rehab, IV antibiotics, things like that. We are a trauma designation of A4. That means we stabilize and transfer. And you're right, as far as OB, Sturgis doesn't do it unless we have to, if it's an emergency. So our emergency room, we deliver babies. We don't want to do it on purpose, but we will if we have to, right? Which is another skill. As far as recruitment and retention, I heard you guys say a lot of things about the same patients, the small communities. That's actually one of our recruiting tools. Our community is very close. A lot of the staff that work here live here. They or close to here, and so yeah, they know each other, they know the patients, and that gives them sense of family. That gives them a satisfaction in their job, in my opinion. You can ask them; they might tell you something different, but that's what I think. As far as the skills and the variety of skills, I think that's huge for nurses. We love to learn. To this day, I'm sure Don would agree. All nurses love to learn all the time. That's what we like to do, and if you can learn every day something new, I think you're more satisfied in your job than normal. And then Don did mention this a little bit ago, is facilities will recruit early when we have students. And I have to say I do that. I'm lucky because I watch, I'm very involved in my department, and I watch the students, and I get to know the students and their preceptors. I get a lot of recommendations from the preceptors when they have students here, which is a huge recruiting tool in my opinion. I think that's basically a 90-day trial, right? Skip the trial, hire the nurse. I think I will save positions if I think it's a good fit. So having a good fit is huge. People that want to learn, that want to be here, have, that's good for us. We have not, since I've been in management of this department, I have not hired a traveler. We don't have any travelers here. And the reason I don't is because the nurses didn't want me to. So they told me, I said, okay, this is your choice. Do we want to pick up extra shifts, or do you want me to hire travelers to help you because you're working a lot? You're busy, you're getting burnt out. What do you want me to do? And they said, we'll work extra. We don't want travelers. We want to own it. So that's what they do. They own it. And right now, I think I pulled up the recruiting or the retention percentages for our facility, and I think it was 9 something for the last year. Which is pretty good. I don't know what the national average is, but I know what Monuments is a little bit more than that. But they have travelers everywhere else. But here, even our long-term care does hire travelers. But I don't have any positions open right now. I have 0. We are fully staffed here, and sometimes it almost feels like we have too many, but that's a good problem to have these days. We do staff 5 or 6 nurses during the day and 4 or 5 at night, which generally gives, even if we're fully, if 25 beds, we like to have 4 to 5 patients to 1 nurse. That's the best care I think that we provide, is at 4 or 5. With 1 in the ER, of course. And our charge nurses or our clinical resource nurses, they do take patients here. I know that's different in some other areas, but we don't have extra staff to not be able to take patients. So we do through Monument Health. There's another detail. Monument Health does recruit. We have a recruiting department in Rapid that works for the entire system, but they don't always open up the positions in each area individually. And so the way that I've been able to recruit people is they specifically ask for Sturgis when they apply. And we're just lucky that way. I don't know what else to tell you, but I just feel very lucky and fortunate. But we will open up those positions in Sturgis specifically because someone's asking. And so I think word of mouth is huge. The staff here, a lot of them have been here 10, 15 years. I've been here for 27 years. And I can't say enough good things about these nurses here. The night shift nurses, a lot of them have been here over 10 years, which again is very lucky because I don't think that's normal. I know you were talking about facility that had a year experience on a night shift. We have some inexperienced nurses on night shifts, but some of our most experienced people work with them. And so we try to have an ER nurse that has experience and a charge nurse that has experience on every shift. And I think that also helps. If your staff don't feel like they have backup, they'll burn out quicker. I'm on call pretty much every day, all day. If they need me to come in the middle of the night, I come in the middle of the night. Unfortunately, it's always for a delivery. So I'm just kidding. It's not always, but I happened to be an OB nurse here when we did OB, when we stopped in 07. So not many people have done that. Other than that, I don't know what else to tell you. I think that's kind of it. Word of mouth, small family feel. I know way too much about my staff, probably. And they know way too much about me, but it's kind of how we are here. And I think that is appealing to people.
Mm-hmm. Yeah. I agree, Ricky. It is very noticeable. Their staff have their friends outside of work too. I hear it and see it a lot. A lot of the USD graduates that I had in Rapid City have gone out there, and there are a lot of friendships there, which I think is part of the reason that they're so strong. Such a strong culture is that they're friends outside of work too, and they're really supportive of each other. I just think you've done a phenomenal job with that, Ricky. To not have any travelers and not have hired any and just to really leave it up to your nurses is pretty unheard of nowadays. What questions do you guys have for Ricky? I would add another thing. I think Ricky and Monument Health are very supportive of their nurses who want to go back to school, because I have seen many of them either go back to get their bachelor's when we had our associate program, and there have been a number now that have gone back to become nurse practitioners. Am I missing anything, Ricky?
I don't think so. Yeah.
Yeah.
And
then
a lot of people that do that. Yeah.
Yeah. And so that has been really great too, that they're just really supportive of whatever path that they're on. And then of course, some of their aides then have stayed to go into nursing school. So there's been a loyalty. Were you going to say something, Ricky, or somebody else? I thought I heard somebody start to say something.
Not me.
Okay. For those of the students that have been in other, the bigger facilities, what things are you noticing about culture that you wish were better? And I don't want to hear specific facilities, just what things are you noticing about culture that you wish were better, where you wish were more like Sturgis, what Sturgis has? or what some of the small rural hospitals have?
I wish there was like a better sense of community. Like I think in larger hospitals, you're just kind of like sectioned unit by unit, and like while you may know other people on other units, like it's sometimes like the communication from unit to unit is very like not really, it's really not good communication. Like when transferring patients, you kind of lose the patient care, where like in smaller, you kind of know everyone. You're able to really like get a good sense of like the patient care that was provided prior to being transferred. So I think I like to see that more.
Yeah, you bring up a really good point. Macy, that was you, right? Okay. You bring up a really good point. And I worked in a bigger hospital for quite a while. I worked ER and ICU, and just transferring a patient from one unit to the other was it was lacking the camaraderie that you should have, the teamwork feel that you should have when you're taking from one, because you didn't know the people and they didn't know you, and they didn't really take the time to get to know each other. Like you said, it was more unit specific instead of as a small rural hospital where you know everybody. Other things that you guys are seeing in the big hospital that you wish which was a little bit different, that you wish was closer to what like Ricky has at Sturgis? Emma, Carly, Maren, Caitlin, you four are on my screen. What are you guys seeing in your clinicals? Emma and Carly, what are you guys seeing? Carly Erickson, Emma Gross. Everyone's being bashful. She's thinking. Maren, go ahead.
I think just like that the manager, like you actually help, and like when they call in the middle of the night, you're willing to go help. I feel like some managers at like the bigger hospitals don't necessarily do that or like have the willingness to help when it's needed.
Yeah, I am so glad you brought that up. That is huge. I think any good leader should know what their people are doing, not just be behind a desk, but do what their people are doing once in a while, so that you have a real true sense to that. Would you agree, Ricky? Don't you feel like you find out things that are happening or that could be better when you're actually there doing the stuff with patients?
For sure. And I think my philosophy is I wouldn't ask them to do something I wouldn't do myself. So yeah, I learn a lot of things when I am working alongside of them. Again, nurses love to learn, so that makes me happy with my job. But yet we also develop that trust with each other when you work with each other, because you have to. You can't take care of other people if you don't trust each other. So if they don't trust me, we have a big, huge breakdown. So I agree.
Excellent. Okay, is there anybody within you? I know we only have like 10 minutes left, and so we certainly can be done too, unless anybody has any other questions. Other thoughts, anybody? I just want to take this opportunity, number one, to thank the four speakers. I thought you guys did a great job. Thank Ricky, not only for joining us today. You said you don't like to speak, but I think she was superb. Don't you guys? Yay. And then I just want to thank Ricky, because honestly, I think the most supportive hospital that we have gone to for this HRSA grant has been Sturgis. I can't tell you how many times I've emailed and said I have a student or students. There's two there. I'm going to see two of them there tomorrow. There's two there right now that want to be in Sturgis. And Ricky always says yes. She always says yes. So I hope for you students that are going to be leaders at some point, you probably will in your career, that you will say yes too, because that makes a huge difference. All right, Stacy, I'll turn over you for whatever final closing remarks that you have.
Thanks, Dawn. Thank you, everyone, again for your presentations. I always enjoy listening to these experiences. So I have dropped the link that is on the screen right now into the chat just to make it easier to click through. Please just take a couple quick minutes to fill out. It's a very short survey and it really does help us develop future programs. Again, this has been wonderful. We are going to archive this on the grnen.org website. So if you want to share what you learned today with peers, other students, other professionals, you can always look for it there. We keep all of that housed in that space for future learning. And we are very excited to be able to continue this session next week with our next in the series of Heart of Rural Nursing. So thank you everyone so much. Hopefully we'll see you again next week, and I hope that you enjoy the rest of your day.
Bye, everybody. Thanks for joining us.
Take care now.